Again, thank you all. This is the Friday, July 7th, Health Council Talk. Let me just pull up my screen here so you can see what's on order for today. So today we're going to have, a presentation by Desiree. Did I say your name right, Desiree?
You did. I don't see Jody there. We're co-hosts today.
Okay, well, I'm going to let you two introduce yourself when you're ready to present. But
Okay.
today, Desiree and Jody are going to be telling us more about the New Mexico Suicide Prevention Network's, oh my gosh, it should say,
Coalition.
I'm sorry, what's your work group's name?
It's a Faith Communities work group.
Safe Communities Work Group. We forgot a word. You'll have to correct us when you get on. But to start with, as usual, we are going to start with our land acknowledgement. The New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, the Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities, while strengthening and respecting our relationships with Indigenous people. We give thanks to the past, present, and future stewards of this land, and we respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. So thank you for that. Desiree, is your partner here yet?
She is here.
I'm here.
Okay, well, I'm going to turn it over to you. You can share the screen.
Okay. I'm not quite ready to share the screen, but
Okay, when you're ready, it should be yours to share. So I'm going to turn it over to you if you could introduce yourself, your team, and your presentation.
Sure. My name is Desiree Woodland, and Jody and I, when we have done these, we usually share our whys. So there's a reason why we do the work that we do with the New Mexico Suicide Prevention Coalition. And my why is my son, who took his life 17 years ago. And I began teaching Breaking the Silence in schools to break down the stigma of mental illness, because I didn't know anything about it. And certainly I didn't know that my students did either. So it's grown from that point. I am a survivor of suicide support group facilitator. I'm on the board for Breaking the Silence, and now working with the Faith Communities work group through the New Mexico Suicide Prevention Coalition. So we're going to be talking about what the coalition is. We're going to be talking about the Faith Leaders Guide and what the future might hold for us being able to work together.
And I am Jody Hicks, and just so grateful and thank you so much for having us today. And my why is because I have multiple family members living with a mental illness, and we had some suicide, or we've had multiple suicide attempts in my family, and then also just a close friend of mine in the past year died by suicide. So I just so grateful to be a part of this. And I met Desiree through a book. It is actually one of the resources that is in the Faith Leaders Guide. And I had a personal connection to her. I didn't even know that she lived in New Mexico. So when I read her book, contacted her, and was so grateful. We became friends, and I also presented with her, worked with her for years at Breaking the Silence New Mexico, and sat on the board for a year. And then now I support another nonprofit that is not based in New Mexico, but we have a team that works in New Mexico raising awareness in the faith community. So I'm just doing all that I can, and so grateful to be a part of the New Mexico Suicide Prevention Coalition. So thank you for having us.
Thank you, Jody. So what we're going to do is just look at, as I mentioned, what the coalition is, the Faith Community Leaders Guide. and then have time to talk about what kind of suicide prevention is going on in your community. And then hopefully have some time at the end. The guide is 30 pages long for the faith community. And it is, that's information from Department of Health, from Suicide Prevention Resource, SPARC. There is from the American Psychological Association and many different faith-oriented papers that are in there. It took a little while to put the guide together. And I looked at the mission statement for Share New Mexico about how the purpose is to bring people together. So many disparate groups doing some of the similar work, but how great to have a little umbrella. And that's really what the coalition is about as well, to be a coalition, to be an umbrella for all the different suicide work that is going on in New Mexico. It was started actually about 14 years ago or so, but it didn't have a structure like a government entity to hold it together. So it's been reborn about 4 years ago, and it is made up of mental health providers, community advocates, government agencies, and anybody who would like to be on that coalition to have a voice to how we are going to reduce the suicide rate in New Mexico, which is, we're the 4th highest in the nation. So everything that we've been doing, we need to be doing it together. So let's see. Oh, I need to mention that we have hard copies of the guide, but we also have a website that we're volunteers, and it's funded by grant money, but we have a website for the coalition, and it is just nmspc.org. So it's not up and running yet, but I think at our last slide, I put the website up so that you guys, if you're interested, could actually look for that. Let's see, what else do I want to say? I think we're just going to do a brief overview of a mission. So I'm going to try to do the sharing. Jody and I mentioned how I don't mind getting up in front of a group of people, but I don't have a comfort level with sharing. So let's hope that everything is able to be shared that I want to share today with you.
So you see the little share screen icon down at the bottom?
And I'm
Sure,
pushing.
okay, great.
Yeah. You guys, oh, I think it's just taking time to load. I don't know. I have a rather older computer, and I wasn't sure that it was all going to work out really well. Sorry, just be patient with us.
Mhm.
Do you want to email me a copy and I can upload it? It might take a few minutes, but I'm sure people would have questions for you.
Yes,
Sure.
okay, that'd be great. Okay, let me just send it to you.
Jody, perhaps when we're doing that, do you have anything more that you can tell us about the work that you're doing and the work in New Mexico?
Sure. Yeah. So when it comes to the faith component, just as we have, and I might end up repeating myself as we go through this, but just so grateful to be able to bring the faith component in. We were in schools all over New Mexico and the rural communities, and so to be able to be presenting to you guys and make that personal connection, because this is all over New Mexico, correct? Am I right with your guys's?
Yes.
Yeah, which is so exciting. And in Zoom, although it has its disadvantages, like what we're doing right now, it has great advantage to be able to let everyone know that this is available. So one thing that I don't think that Desiree mentioned is that you can get this in PDF form. And so that's kind of great. So you can print up your own copies of it. But, you know, just really grateful to be able to do this when, you know, when people don't have a personal connection to this, and sometimes even when people do, it's just not a comfortable language to talk about. Now, Desiree and I have been talking about it for years. And so whenever we go to present, we just sometimes, you know, have to remind ourselves, not everybody has hit this in their family yet. And so, so the language doesn't come necessary, but or come easily, or, you know, even if it has, some people just are at a point where they can't talk about it. So again, just grateful to be able to be doing this, and, you know, all of the people that have been a part of it. And, you know, you could name so many names, but just thankful. You know, maybe I could just ask this question while we're waiting. It was one that we were going to ask in a little while, but, you know, what kind of suicide prevention work is going on in your guys' communities? So maybe somebody could pipe in and answer that question right now.
Good idea. Let's have Q&A first, folks. Either in the chat, which I'll keep a look at, or just speak right up. Anybody?
Mhm.
Rebecca Johnson does want you to know that she's one of the community outreach prevention and education specialists with Sage Memorial Hospital. Rebecca, are you seeing a concern here with suicide coming into the hospital?
I believe so. We are part of the grant funded office at Sage, and yeah, we're seeing not well. I haven't really gone into it yet, but we are in the process of getting trained on certain areas.
Okay, I think we have the slide. Just hang on a second. I will download it to my computer so we can.
It's everyone's worst nightmare, and I thank you for your eyes. Oh, it's QPR. Yes, here. Okay. Oh,
Okay,
that's really good.
let's see if we can get that up. Hang on just a second.
Well, and while you're doing that, I'm actually glad that we asked that question to begin with, because I mean, possibly as we go through this, it's interesting, the stigma that does surround this. So, you know, the fact that nobody said anything, hopefully as we go through, maybe something will, you know, transpire. And where we were going to ask the question before, I'll ask it again. So hopefully, like, if you know of any suicide prevention, you know, things that are happening in your area, if something comes to your mind while we're going through this, as I ask it again, hopefully somebody might speak up. So anyway, okay,
Thank
Desiree,
you
go
for
ahead.
keeping the conversation going. I appreciate it.
Oh,
so
sure.
much. The New Mexico Coalition has a mission statement that's very similar to Share New Mexico, and it's important that we advocate and collaborate and educate. I think about the coalition as the umbrella, but we have some work groups that I'm going to talk about in a minute, but ours is the Faith Communities Work Group. And I think about, for myself, you guys mentioned stigma. You know, there's so much stigma, whether it's religious or cultural, and misunderstanding. So this guide, I wish, had been in the hands of my faith person that could have helped me with those kinds of emotions and feelings. So the Suicide Prevention Coalition, we have a strategic plan that we have two people from Department of Health. They are the New Mexico Suicide Prevention Coordinators, B. Chavez and Naja Druva. And then the coalition itself, which is totally volunteer. has two co-chairs, Paul Beers, who is a retired fire chief, and Kate Reeves, who works at Presbyterian. We have, I guess I'm ready for the next slide there. So those work groups that I talked about, ours is at the top there, the Faith Communities work groups, but each one of them has some chairs. Jody and I co-chair the Faith Communities group, but we're trying to cover a broad spectrum of what kinds of activities for suicide prevention are going on in our state. And some of the groups are, more active than others. We try to just involve as many different organizations. So perhaps there's one that we have missed that we could be adding to the list. And I also wanted to invite you, if anybody was interested in joining the coalition. It only meets quarterly, much like this meeting that you're doing here, but it kind of keeps you the pulse of what's going on around the state of New Mexico when it comes to suicide prevention. Okay, let's get back to Jody's question, because I know she asked it and it's an important one that we listen to.
Yeah, so once again, the question was, what kind of suicide prevention work is going on in your community if you're aware of it?
I'm just going to stop sharing for a minute so we can see. Okay, we've got some stuff in the chat here. So let's see what we've got here. Erica, tell us about your awareness events. First of all, Erica, tell us where you're from.
Hi, my name is Erica Meadows. I am with the LC8 or with a judicial district, 8th Judicial District, which is Taos, Colfax, and Union counties. It's Clayton, Raton, Taos. So we have real different programs going on in the different 3 counties, but we've done lots of events. The Health Council here in Colfax County did a suicide awareness walk. We've done some PSAs that we put on Facebook and on the radio here. I know we have a lot of literature that we handed out at all 3 of the health fairs, the county health fairs. We handed out gun locks and locked medication bags with literature that goes along with them to help with, lethal means, trying to keep that out of people's hands. We do a big presentation on with our mental health first aid that has a big section on suicide in that, and we've done a big push trying to get that, at the different schools, presenting for the teacher in service days, the mental health, especially youth mental health. Lots of stuff. It's been the focus of, like I said, 2 of our 3 counties health councils for the last couple of years, several years actually, because we have really high numbers up here in our rural area. So it's been a real focus of, not just the LC8, but I work for a state agency. Our state agencies, we have questionnaires whenever anyone comes in, any kids come in, their families. That's part of the initial questions that we ask them, is if they're contemplating suicide, or, if they are, if they've had a plan. We go through the whole rigmarole of all the questions, and referring into services if that's what they need. So we do lots of trainings around that.
Wow, that sounds amazing what you guys are already doing. You just can't imagine how much time and energy it takes to do everything that you're doing, but we would love to have a conversation with you later if there's interest. We're really looking to have 2 coordinators, one from the Taos County and one from Santa Fe, to kind of do what we're doing, and which you're going to learn what we're doing here in a minute. As far as the faith communities go, because that's one aspect of this work that needs to be kind of pulled in as well. And that's what our purpose is. So thank you.
That's a great idea, because in these rural communities, that's where people gravitate to, is to their faith communities, because, we don't have a whole lot of providers. And so a lot of the counseling goes through ministers or other parishioners, other church members. So that would be really helpful up here.
Okay, wonderful. Thank you.
Thank you.
Is there anybody else, Wendy?
I know a lot of you are doing mental health first aid, are you not? Geraldine,
Hello, my name is Geraldine. I'm the tribal liaison with the Alliance. I was just gonna share some information that at least that I've heard from tribal health councils. And so they've been doing a lot of work in collaboration with the tribal 988 hotline project or initiative that's statewide right now. And so they've been working alongside with them, giving out a lot of educational materials. I know some tribal health councils have had suicide awareness walks. For example, a very specific one from Tohajale Canyon Cito Band of Navajos. They've been doing drumming circles. They've been having Native American practices and ceremonies for those like those who have done suicide attempts, but also dealing a lot with grief and loss from COVID. And just a lot of mental health awareness projects that they've got going on. And so, yeah, just wanted to note that's at least some of the stuff that I've heard that tribal health councils have been doing.
That's exciting to hear.
this might be a question then for your faith community work group. Have you made a connection with the Native faith community?
You know, we have not yet. And so that is an absolutely wonderful connection. And that's actually why we jumped on this opportunity to come and share and have conversation with you, is because we are looking to kind of pull some of the pieces together with the faith community. So will we get copies of emails and stuff, Wendy, or is that something that can happen?
Sure. Let's talk about getting you connected, however seems appropriate, but definitely Geraldine is your primo connection for our health councils, our tribal health councils, and the larger tribal community. So Geraldine, maybe you can put your email in the chat, and also Desiree, Jody will make sure you have that.
Okay, doing it now. Thank you.
Okay, anybody else here want to make a connection with Jody and Desiree and tell them what you're doing? Goodness, folks.
Well, Geraldine, I was so encouraged to hear you say this was something that we had come up with, and I don't know if you guys can see this, but you had talked about the 988, and this is something that we thought every faith community secretary should have on her desk. So I don't know if you guys can see that very well, but it's one of the resources that is a part of that will be a part of the PDF that you could download. So super encouraging, and maybe it might be helpful for the youth or whoever is doing this, that we just encourage people when we go through this that take a picture of this, put this on your phone. This is some language that can be helpful if you're in this situation, even though we do this type of work sometimes. When it happens or it's right there, you're like, oh gosh, what should I say? What should I not say? But if you have it, just in your phone, it can be really helpful as a resource. So just really encouraged to hear them taking that initiative on the 988 number. So.
Great. Do you want to go back to your presentation? Just let me-
Thank you.
Yes. Okay, let's go back there. Do we need to move forward?
Please move forward one.
Okay.
So the Faith Communities Work Group, it is ecumenical, all faith religions, Christian, Jewish, Muslim, Hindu, Native American, or Buddhist. We just want to reach everyone at wherever they are, because we know, as people who are aware of mental health, that 1 in 4 people, no matter where, might be at risk for a mental illness. And that's part of the purpose of the Faith Communities Work Group, and also to encourage training. And so you guys already mentioned ASSIST, QPR, mental health first aid, and all of those are in this faith communities. But if you think about it, sometimes the faith leaders are not aware of what kinds of resources are out there. And so that's why we're focusing so much on the faith communities. What do you want to say about that? Well, we just also want them to have the language to talk about it, because people don't, a lot of times people will reach out to their faith community for support for the struggles that they're going through. But sometimes there's not maybe understanding and maybe a lack of compassion because people don't have the education perhaps to be able to engage in that conversation with the people that they worship with. So that's part of what it is. And we've been doing a lot of meetings really one-on-one because relationship, oh my gosh, you hear somebody's personal story and it kind of opens the door. Because as you can imagine, there's a lot of differences and lots of space in between how people view mental health in the faith communities. It can be anything from, that person is a demon possessed, or it could be cultural, or it could be societal. So part of our purpose is to encourage training and more education so that we can all be able to be compassionate to the people that we worship with. So next slide.
Oops. Oops, there you go.
Okay, so this is the cover of the Faith Leaders Guide. And down at the bottom there, you'll see that the U.S. Office of Surgeon General, National Alliance for Suicide Prevention came out with this quote in 2012. So I'm just going to go ahead and read that. I know you can read it, but I'm going to read through it anyway. So suicide can be prevented. Just as suicide is not caused by a single factor, research suggests that reductions in suicide will not be prevented by any single strategy or approach. Rather, suicide prevention is best achieved by a focus across the individual, relationship, family, community, and societal levels, and across all sectors, private and public. So this, we just really love that quote and wanted to have that on, the front. But, these pictures were all taken in New Mexico, and it just is, we've worked with a woman named Amy Allen to help us put this together, the Faith Leaders Guide, and we thought it turned out really beautiful. So we hope you enjoy those pictures. And then let us see, what else did I want to say? I think maybe just going to, so wanted to let you guys know that the guide has been vetted by chaplains, community leaders, local pastors, and mental health professionals. And it's divided into two parts. One is for the faith leaders who, as Desiree said before, are increasingly, being called upon to counsel members who are struggling with a mental illness or suicidal ideation or addiction. And then the second component contains handouts that congregations can use in their congregation. So if you go to the next slide.
Whoops, sorry.
Please. That's okay.
Ah.
Okay, and so this resource was put together by Saddleback Church out in California, and some of you may be familiar with Saddleback Church, but it's Rick and Kay Warren put this together after their son died by suicide back in 2013. They have an enormous congregation out there, and a quote by Kay Warren, she said that once her husband started talking or discussing the issue at their faith community, it gave many of the people to come forward and talk about what was going on with them. So just the value of hearing it from the leaders is huge. And so their personal connection, we understand the confidentiality of it as well, and the stigma, and as did they. And they really did everything that they could to protect their son's privacy as he was growing up. But they are very open and have, tons of resources, and this is one of them. So this is ideas that they gave that your faith community could do. And these first two, the crawl and the walk, they don't require much money at all. It's just, the ideas of, speaking like Suicide Awareness Month is in September, and there is we put a sheet in there for every month. There is a way that a faith leader could be talking about mental illness. And so, like I said, those first two, as you read through some of those, if you're reading through some of them, they don't cost much money, but it's basically putting it out there. And then if you go to the next slide, which is yeah. You know, the run would be having a mental health ministry, you know, full on mental health ministry, which would be, you know, having counselors, all of those kind of team, having the trainings, you know, building teams within your faith community. So that cost, you know, that could have a lot of costs going into that. Let's see, what there was one other thing. Oh, one of the things that, you know, with our faith community, after our faith leader's wife, who was a friend of mine, died by suicide, we had Desiree and her brother come in and you know, tell their story. And that was a beautiful gift that they gave us, and just spent the time talking about a very, very difficult and stigmatized, you know, thing. So, you know, that's something that doesn't cost money. It's just a willingness of someone to come forward with their story to help save lives. So we were so grateful, you know, to have them come and do that. So anyways, go ahead, Desiree. Next slide.
Yeah, next slide. Okay, so we just kind of picked and chose which slides we would use for presentation with you. I mean, everyone will have a copy of the PDF. I think I sent it to you, Wendy, already, right? But what's so great about having these resources is that it's in a bound book, but it's also going to be online. So as statistics change, like with the Department of Health, it can all just be updated. So it feels like it's very sustainable, and we're so grateful that we are funded by grant money. But we have, you know, some resources to be able to get that website up and going. And this is one of the handouts that if a church was wanting to talk about suicide or mention it in the sermon, this might be really great for the congregants. This comes from the congregate section, and it talks about what the definition of mental illness is. And I'll just quickly go, I won't read it word for word, but I think it's so important because the general population may not even know about what it is. I mean, you know, it's just something that's so stigmatized, we just don't talk about it. But just that mental illness is a mental disorder that is diagnosed, and it affects someone's thinking, feeling, and emotions and how they function in the world. And it's also important to know that it's treatable. We know that mental illness is on a continuum. Those of us who have done the work for a while, but we are hoping to be able to use these to educate clergy. But there's so many different treatments coming out now. Some of them are like the psilocybin and the ketamine and all of that. And I know that that's been effective for some people. So I'm so grateful that there are things like that that can help. And then the definition of what mental health is. A state of well-being in which every individual realizes his or her own potential and able to make a contribution to the community. So what I found in the work that we've done is that many people who have a mental illness don't want to talk about it. It's something that seems very private, but we want people to know that it's nothing to be ashamed of, that it is, you know, if you had cancer, you wouldn't be ashamed of that. You would, you know, be grateful to have some medication and be able to talk about it as it's an illness. And also that the bulk of mental illness occurs by age 24, 3/4 of it anyway. But it's all, I mean, it needs a professional to be able to say whether, you know, someone's emotional state is worthy of an, you know, having a, what do you call it, being looked at by a professional. And then the next slide has another piece that's dealing with resistance. And that was kind of what I talked about. Like sometimes people who have mental illness don't want to talk about it at all. But I think we've talked enough about stigma and just being able to, you know, recognize that it comes in all shapes and all forms. And it may be why someone doesn't want to talk about it or isn't. I'm not sick. I know Dr. Amador, which is in one of our resources. We have a bibliography resource for all different faiths. And then we also have those specific resources that are available for trainings or other readings other than what's in the guide. But anyway, dealing with resistance is an important part because I know from my faith community, it wasn't ever talked about. I never heard about it talked about in the context of faith. And I think that that's part of the stigma because we, you know, I don't know that I thought it was a demon possession, but I certainly thought that happened to, quote, troubled families, right? It couldn't happen in mine where everybody was loving and kind, and yet it did happen. And, you know, my son did take his life. And so I was desperate for the kind of comfort that could come from faith, and I wasn't able to find it. So personally, I'm so grateful that this guide is available for that. It
Can I
does.
make a comment?
Please do.
Desiree, just wanted to add something to that. And not being, just as we are on the Zoom when all of the names are out there. So not being able to see people's ages and, what you look like. Our youth is just craving and so desiring. And, when I absolutely want to pull social media into this because, kids are getting, they are talking about it. They want us, I'm my age, I'm 50 and I don't care saying that, but, just saying like, I feel like it's just our, the older and maybe, I feel like our 30s and younger you guys are definitely more open to talking about this, and our younger, I just know that our youth is just, they are so desiring, to be seen, to be heard, to be, like they are struggling in that way, and who are they going to go to, so my heart is so for the youth in this.
Thank you.
Mhm.
And just, I guess I'll piggyback off of that, but just thinking about the language that we use, that language does matter, and how we talk about suicide, whether it's with youth or with older people, that it makes a difference whether we use language like that was such a selfish thing to do. I mean, that basically just comes from misunderstanding. And so as this is a document to help educate congregants, there's some of that information that's on there. I don't know, maybe it would be a time to say, what kinds of comments have you guys heard in conjunction with suicide? Because there's some common statements that society can make that are very hurtful.
Anyone want to contribute? Oh, Jennifer, I hate when people call it weak.
Mm.
Yeah.
Mhm.
Howard's way out. Oh,
Uh,
that would be hard to hear, wouldn't it? Mm.
and those definitely are painful to hear. And I think, coming from a faith person can even be more painful because it makes you feel pretty hopeless. Our job in the faith community is to provide hope and help for one another and how we can love people well. And so it seems really important. I think there's another one going on there.
Yeah, just the blaming that goes on, especially to the families involved. You mentioned that, Desiree, that it must be a dysfunctional family.
Right, right. One of the things that comes with this guide, and if we can find a couple people in northern communities who might like to help us get this out, is a little purple book that we use in Survivors of Suicide, called the SOS Handbook, and it really does address some of those painful pieces and how much more meaningful to come from a person of faith who understands that those are not things that you can say to people after they've lost someone. And even in the guide, there's some direction for clergy to be able to do a funeral for someone who's taken their life. Of course, doing this work for a while, we've heard of a few that are just very hurtful, and I don't think anyone's intention was to hurt someone. It's just we don't know what to say, or we just don't understand. So, so the next slide is what helps and what hurts. Oh no, it's not. It's another one that we use in congregants. my mental health, do I need help? So important that people can, have something to maybe take after a sermon that might have mentioned mental health at some point, but to be able to ask themselves the questions and to be given it in a faith community, I think adds very much legitimacy to what that person is struggling with. Although this one does come from the National Institute of Mental Health, but it's a really good one. So I guess that's why it got thrown in here. But you'll get copies of all of this for sure. So then the next slide. Okay, this one is from the Survivors of Suicide group that I facilitate here, which, by the way, SOS is one of the resources, because we also do it not only just in person, but we have it on Zoom as well. So we have people coming to our groups from Mexico or other countries. And, there's just not enough support for survivors. So this came as a result of conversations that we've had with other survivors about things that help. And then, of course, things that don't help. So some of them are general grief, but the things that don't help are the very things that you guys put in the chat. It doesn't help at all. It reinforces the negative stigma and the pain that person is feeling. So I think
I love number 7. I was just going to say, I have number 7, like how it says, don't rush me. This is going to take as long as it needs to take. Just walk by my side as my friend and respect my desire for privacy in the beginning, and just how huge that can be. But one other thing that we had down that I feel like is so important to say is that, the feelings of a survivor are valued, and, like their anger with God or loss of faith, guilt, self-blame, without someone trying to fix the grief, listening is the most powerful medicine that you can give someone. So just wanted to mention that as well.
thank you for that. That is very powerful medicine. And I am so grateful for the people that listen to me. And well, I think we have done some outreach. And I think Jody's going to share some of those. We met with the Jewish Community Center and chaplains from Santa Fe. Jody, do you want to share a few of those?
Yeah, we've met with some chaplains at Calvary of Albuquerque, if you guys are familiar with that church. And we've actually met with, individual faith, institutions. And we have another upcoming meeting with New Mexico Conference of Churches. But, our heart is that, whatever faith community, we do realize that some of this might take some travel we know it's relationship based, and we will do our best to do what we can to come alongside. But I know Desiree had, mentioned before that we really do desire, if it's not you, if someone in your community who would be passionate about doing something like this in your small town, that, if we are able, we would like to come out, or, even if it's a phone call, however we can do it to come alongside. This is just our heart, and we desire to do that. We really have only had one pushback from a faith community, but our encouragement was, because, how he said it was, we don't deal with that here. And, but he kept the information. And so, sometimes you can feel a little bit discouraged when you're doing this work and you get a response like that. But at the same time, our hope was, well, you know what? He kept it, he didn't give it back to us, so it's there. And maybe, but he had also told, he actually had a personal connection to it, because one thing that he did reveal to us was a personal connection. So you just never know where that's going to go. So anyways, he had the information, so it was not there was no loss there at all. So anyways, just wanted to say that.
And if you are interested at all in doing this in your community, I think Jody said it best. It's really relationship based, and you guys know your community. And so if it's not you, maybe there's someone else. I think we actually do have a small stipend that might be available to help. We also have lots of copies of the guide to give you, and we'd like to meet with you. Because that just seems to be like an important part of what we need to be doing, is reaching out with one another. So if that's the case, I don't know, Wendy, if they could contact you, or I didn't put my personal email in that chat box, but
Why don't you do that, Desiree? That would be good. And
Okay.
then just to remind everybody on this call, and also to let all your friends and colleagues know that Rebecca West will be posting this information, including Desiree, the slideshow and a copy of the guide.
yes.
We'll be posting links to that on our website, so you'll be able to access it that way also. Did I say that correctly, Rebecca?
You did, and it'll also go out in our one of our announcements next week,
Great.
our email announcements.
Great. And then Geraldine also is, as I said, a wonderful connection to people who are working with members of our tribal community, both on reservations and in the cities all throughout the state.
We're so happy to know you, Geraldine, and would love to welcome you on the coalition. There is a Native American work group, and I'm trying to think, it's Teresa Gomez. I'm not sure where she's from because I'm not as familiar with that work group, but that meeting is happening, and I can send you the link. I'll send you the link, Geraldine. Are you interested in maybe coming and checking it out, the meeting?
Yeah, thank you so much for the invitation.
You're welcome.
Yeah, and I could also send the invite to tribal health councils as well. I know there's a few who have been focusing on mental health and suicide awareness. So yeah, I will definitely share with all tribal health councils.
Oh, thank you so much.
Right. And you community health councils that are on this call, this information will be available for you also to share with your communities. So please take advantage. I think, what was it, like at least 2/3 of our communities, of our community health councils listed behavioral health and or suicide as a primary concern, as it is throughout the state. We know that. So we have a few.
Yes, I'm so sorry. We just have a little, the next slide is just a quote, and then
Oh.
the last one is who we wanted to thank for helping us put
Oh.
the guide together.
Okay, hold on just a second.
Oh, did you already get out of it?
I
Sorry.
will go back there. Yes, there's a beautiful quote here.
You know what, Wendy, would you read it for us?
What good people can do in the face of great sorrow. We can help some time pass for those suffering. We sit with them in their hopeless pain without trying to fix them with platitudes. Doing this with them is just about the most gracious gift we have to offer. We give up what we think we should be doing or what we think needs to get done to keep them company. We notice the messiness, the discomfort, and the emptiness, and let it be there until some light returns. That's from Anne Lamott, and it's absolutely wonderful.
It's a nice way to end this Faith Leaders Guide and this time together. Thank you for reading that.
And then you wanted to thank these folks?
Yeah, just to say thank you to the New Mexico Department of Health, because they kind of stepped in and helped us get off the ground. One of the pastors that helped us, the chaplains from Christus St. Vincent, the work groups, United Church of Santa Fe, Presbyterian Anchorage, and we've gotten many from Anchorage, so I really wanted to let them know about that. And there is the website. When it's up, it's nmspc.org, but it is going to be on the share website as well, so you may not need that right now. So anyway, thank you so much for this opportunity. I know Jody and I are just so grateful for your interest and your attention, and I'm sure that you're all paying attention in there, but I can't see you, but I hope that you are.
Great. Couple more minutes. Does anybody have any last thoughts or questions for Desiree? Yes, Brenda, it was wonderful. For Desiree or Jody? Any last thoughts there? Okay. Thank you so much, Desiree. This work is invaluable and absolutely needed, says Karen. And Barbara Owens, thank you so much. This is wonderful, says Rebecca Johnson. I agree. Thank you so much. Thank you so much for presenting such a thoughtful, inspiring, hopeful message to all of us who are grappling with this challenge that we're facing here in New Mexico. So I encourage all of you on this call, and please get the information when it becomes available, pass it around. Contact your faith communities. We know they're an important part of health councils. They're an important part of creating healthy communities. I know many of you have connections with your faith communities, so here's another resource for them. So please do let them know. Again, thank you, Desiree, Jody,
Mm.
and we will see all of you in 2 weeks.
Thank you.
Thank
You
you.
guys have a great day. Thank you.
Thank you.